Hi, my name is Dr. Rudraman, and through the Oral Health channel today we're going to be talking about parodontalgia. Let's start. So parodontalgia, if I want to break it down, baro means pressure, odont means teeth, and algia means pain. So this is a toothache related problem which is concerned with change in atmospheric pressure. It is either seen in the ascent or descent during a flight, or it is seen during the descent in a deep sea diving phenomenon. So what happens is, because of the fact that when we are flying, or if you're flying very frequently, or if we are doing deep sea diving, there are a lot of rapid pressure changes which sometimes cannot be compensated by the vessels in the tooth. And that's why, because if you have any open carious lesion, any faulty or leaking restoration, any periapical pathology, vital pulp pathology, or a necrotic pulp, you might end up having something known as parodontalgia, which is a debilitating pain. It might be transient, but then again it is very debilitating, which can cause a lot of problems to aircraft crew and pilots, especially because of the fact that if it can be so debilitating, sometimes it might pose your whole flight at risk in terms of you not being able to operate properly. Although most of the pilots and air crew are always they're asked to do a proper routine oral examination, especially the military personnel, and it has been found that parodontalgia has been found more in civilian aircraft crew and passengers and pilots as well. So what is the cause? The cause is very simple. If you have any leaky restorations or poor oral hygiene or open carious lesions or any sort of pathology in your pulp, and you're planning to fly, and the chamber is, even if it's pressurized, you might end up having parodontalgia. Or if you're a deep sea diver, you're going for a deep sea dive where the pressure increases with the depth, then also you can have parodontalgia, and it is a sharp shooting pain which is very debilitating, and it can cause a lot of problems in you functioning because of the fact that it is paining. It's a very small population of people that belong to this term, but it can happen to even passengers as well. So if you're a frequent flyer that you have to, for business purposes or whatever reasons, you are flying very frequently, it is always important for you to make sure that you're getting your oral hygiene in check. Now, studies have been conducted amongst air crew and pilots of military and civilian origin. It has been found that civilian population has more of this happening compared to military personnel, because of the fact that they have to undergo the physical examination of getting themselves checked in terms of oral health screening, and that's why they have to get their oral hygiene is much more meticulous and proper compared to the civilian population. So if you actually talk about it, the mechanism of action, there have been a lot of theories that have been proposed, but very simply put, in order for you to understand as a patient, any sort of pressure changes causes problems in the tooth, which is carious, has any sort of pulpal pathology, a faulty restoration and open carious lesion, because of which when the pressure changes, the tooth is a closed system, so all the nerves and vessels and blood vessels that are there might not be able to compensate for the change in pressures, and that's why the change of the pressure, which decreases when you go in the ascent and increases when you go down in the water in the deep sea diving, the tooth is not able to, the vessels in the tooth are not able to compensate for the change, and it can cause sharp shooting debilitating pain. What is the solution? The solution is very simple. It is just prevention. You need to make sure that you are maintaining oral hygiene, good oral hygiene, proper oral hygiene, getting frequent examinations done. If you have any kind of carious lesions, you might want to get them treated. It has also been proved in studies that it is better to avoid pulp capping in patients like that who are frequent flyers. Always better to go for endodontic therapy. And for military personnel, they've been asked to ground the personnel 7 days at least before their flight and after their endodontic treatment is completed, so that they cannot have this kind of a problem because of the pressure changes in the atmospheric pressure. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message on WhatsApp with your name, your location, and the common oral health problem that's causing you discomfort or pain, and I'll get back to you in a couple of days. And please be patient with me as much as possible, because I have a lot of messages, a lot of love from my patients and my viewers, so I cannot reply them on the same day, and I'm really sorry for that. I'm going to try and work better towards it. And if you have any queries, doubts, apprehensions, or insights or suggestions, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.